Hi, and welcome to Digital Health on Air. I'm Alex Esquivel, and I lead marketing at Luma.Health. I'm joined today by Colin Hung, who is the senior editor at Healthcare IT Today. He is also the editor-in-chief of the Swaay.Health healthcare marketing community. Colin is a leading voice in all things health IT and healthcare marketing. So we're super excited to dive into how marketing is shaping the patient experience and the patient journey today, and generally how people access care. So super excited to jump in, Colin, and nerd out on all things marketing. Welcome.
Yeah, thanks for having me, Alex. This is going to be fun.
Yeah. So I would love to hear, can you just tell us a little bit about what you do today, a little bit about your work in general?
I joke with people because I say that my job is really a professional conference attendee. That's really my job. I go to about 40 or 50 conferences a year. Yeah, that's four with a zero. So, HIMSS, Health, Vive, all the big ones, RSNA. But that is a wonderful opportunity that I have to connect with people working in the healthcare industry. So providers, payers, vendors, nonprofit organizations, government. It's a lot of fun. And so most of my time is spent going to conferences, talking with people, doing interviews with executives, and then putting out that content in video, podcast, and written form.
So from my understanding, Sway focuses both on the health IT marketing side of things for people like myself, but also on the provider side marketing. For today's discussion, I'd love to focus more on the provider side marketing. It's super fascinating to me. What's one thing that somebody maybe outside the industry wouldn't realize or wouldn't know about healthcare marketing on the provider side?
Yeah, probably that it exists beyond the foundation. Most people are familiar with providers and their foundation work and the fundraising that they do, but really that healthcare marketing does exist at a provider, and it's very unique because although it is B2C type marketing, a lot of the B2C rules for regular marketers don't apply in healthcare because healthcare is a very special kind of industry. So I think that's what surprises people the most. A, that it exists, and B, that it's not quite the same as regular marketing.
Yeah. Could you elaborate on that a little bit? What do you mean as in terms of it's B2C, but maybe not all the rules of B2C typically apply?
Yeah, I think almost every other place in our lives, we have the option to buy or not buy something. In healthcare is unique because you have you need to get care, right? In some cases, it's very acute. You have to go to the ED. Something's wrong. So in that instance, that is very unique in the marketing space. I mean, most other markets have to compete with discretionary income, discretionary time. In healthcare, it's very unique in that way. And there's a privacy involved. There's a lot of regulations involved. So that's why I say it is unique. A lot of the principles apply, but they have to be adapted to healthcare marketing.
Yeah, that's really interesting. I was talking to the team last week, and somebody shared, it was actually from a customer or a discussion that they were having, and somebody shared something from the health systems marketing team, and it was a traditional funnel that we use on the health IT marketing side. And I thought that was so interesting to think of patients. I mean, we hear in other areas of healthcare talking about patients as consumers, but when you see it applied to like a traditional marketing funnel in terms of top of funnel, middle of the funnel conversion, it's like, wow, that also applies to healthcare, which is strange when you think about, like you talked about, getting and needing care.
No, it's true though. And it is sort of a more modern take on healthcare marketing on the provider side is to think about funnels and is to think about patient journeys, right? And journey mapping and things that, we've done traditionally on the B2B side a lot of and on the consumer side, but now bringing it into healthcare. And it is unique, right? Like for some patients, the time to the distance between the need and execution is very small because in an emergency situation, you're not taking the time to do a lot of research, right? But in other cases where it's less acute, you are doing a lot of research. You are more of a traditional enterprise funnel, right? Where you're doing a lot of work ahead of time before making a decision to go seek care.
So, in attending 40 conferences, and I'm sure talking to plenty of other people across the world in healthcare marketing specifically, you probably have a good, and for doing it for, I think you said over 20 years, you have a good idea of like where the industry's been, maybe where it's at today, where it's going. Can you talk about some of the trends in healthcare marketing on the provider side, maybe like where you see the next 5 years, or even like how it's changed over the past few years?
Yeah, well, it's changed a lot, but I think every year you probably can say that, right? But there are some trends and things. I think one of the biggest trends that we're seeing is there's a lot more focus being placed on the digital front door. So this would be sort of pre-appointment. So a lot of things around how do you help patients who are seeking care find you? And that's sort of a new area of marketing. Before marketers, providers, would do a lot of awareness campaigns, right? It would, TV ads, billboards, being in the community and so forth. And those are still important. But now it's like, okay, what happens when someone types in, I'm looking for this type of doctor in my region in Google, and are they going to find you? And when they find you, can I actually book without having to call you? Can I do everything online? So that is really new, because in healthcare, it used to be we would tolerate phoning in or having to actually go to the office sometimes and make an appointment. That is no longer the case, right? If you want to compete in 2025, you have to have these things. So that's one of the biggest changes. And another change is that there's more competition now than before. There's more options that I have available to me to maybe get something through telehealth. Maybe there are multiple providers if I'm lucky enough to be in an urban center for that. There are some competitive forces that I may not have had to deal with before. And then, of course, there's the big one, which is, of course, AI. And AI has definitely changed the game in terms of what marketers have to deal with in healthcare.
Yeah, so let's dig into that a little bit. I think there's multiple directions we can take the conversation on AI in terms of like tools available to marketers, like automations, efficiency, all sorts of things. But maybe let's talk about that patient pipeline still in terms of LLMs. In the first example you just gave where people are searching Google, well, now Google has an automatic AI response at the top. We have LLMs like ChatGPT, Perplexity, you name it. So a patient is going in, they're typing in their symptoms or whatever it may be, or looking for the best provider for a surgery that they know they need or whatever it may be. And then, some people may even say that that information that it is care itself that they get. So how does that maybe elevate what marketers are doing in terms of the information that's provided and consumed by patients?
Yeah, well, this is a huge change, and we're right in the midst of it. So, a lot of work still needs to be done. But basically, if you go back a few years, even 5 years ago, when you typed in, "What do I do when I have a bee sting?" Right, something as simple as that,
Mhm.
it would give you Google would automatically know where you were, and so it would bring back search results that were localized to you. So if my local hospital, my local doctor's office, my local allergist had a page on their site that talked about bee sting, what to do, Google would give that one priority in terms of the search results, right? Because it's localized. Well, but now when you type in that same question in Google, now you get an answer, right? Because Google AI is going, well, you want to know what to do in a bee sting? Well, I don't need to localize this for you. In fact, I'm going to go to the most trusted source on bee stings, which may be Mayo Clinic or maybe WebMD, or maybe it's a journal, the New England Journal of Medicine maybe has something there, right? So now people can just get the answer. So if I was just looking for what to do and I don't need to go get care, well, your site is now no longer the place I have to go to get an answer. I just get it right there. So this is, to me, fundamentally changing, and we hear it from all of the marketers I speak to. It's kind of fundamentally changing what kind of content that people need to put up on their website. It's no longer this generalist health information. It has to be much more specific now in order to be where the patients get to in their journey. So, at the beginning, I just may be doing some symptom searching. I get the answers from ChatGPT. But it's now at the point where if I'm looking for care, that's when you want to make sure you pop up, right? So you have to kind of focus more on down funnel type stuff.
Yeah, that's really interesting. And I think too, with the rise of AI and what you're talking about here, building trust with patients is all the more important too. Can you talk a little bit about that impact, not only with the health system and patients, but also with the providers as well? Yes.
Yeah, I think one of the biggest things was, back when you created a lot of this general health content, that was the way you built trust, right? You became this trusted place locally where people can go to get good health information. But now that that's kind of going away with the changes with LLMs and the way Google does its searching, now you have to build trust in other ways, right? And to me, trust builds down to a couple of really important things. It's really about being transparent. It's showing up where people are. It's being consistent, right? It's all these things. And so how do you do that in an online world? Well, to me, it means, first of all, to build trust, you should probably involve patients in the design of everything you do, right? That's probably the best way to build trust, is get them involved. And when I say get them involved, I mean co-designing, not just asking for an opinion on something that's already built, right? So instead of like building a website and going and then showing it to patients going, what do you think? Like, instead, when you have that blank canvas, get them to come in and say, okay, listen, how do you book an appointment? How can we make the appointment booking process better together here? And when you do that, and then that will make your what you come up with, A, better, and then B, those patients will then go and spread the word and say, hey, well, actually, I was really involved in the design of this. So that's probably one of the best ways to build trust. And then the second thing I'll say is meeting patients where they are in terms of culturally, but also language, right? Making sure that whatever you produce is in the local languages of the communities that you serve. It means making sure that you appear in the places where they are. That might be the local barbershop. That might be the local restaurants, the Y, places where, Google can't get to, right? So you need to think about how to build trust in those places. And I think that's probably the best way and probably the only way right now to do that.
That makes sense in terms of a like holistic vision of building that consumer patient experience for a health system. Switching gears a little bit, I was listening to the Sway podcast recently, and with your guest, you were discussing a very interesting law, which again, this is not my area of expertise, but I was like so intrigued when I heard this. So there's a law meant to stop robocalls for Medicaid. Is that correct? However, one of the unintended implications may be that health systems can't text their, or sorry, not health systems. I think it was
Medicaid.
Medicaid
Yeah.
members might have to prove eligibility by fax. Is that correct? Can you break that down a little bit?
Yeah. So there's an old law, it's 30-year-old. And by the way, credit goes to Abner Mason from Ground Game Health because he was the one I did the interview with, and he was the one who made me aware of this. But yeah, there's an old telecommunications law. It's called the Telephone Consumer Protection Act from 30 years ago. And yes, it is meant to stop phone calls from people you didn't authorize and texts. So if you never had a relationship with a company, they can't text you, they can't call you. It's to stop the robocalling, right? Makes sense. However, when you sign up for Medicaid, you actually don't sign up with a particular plan. You don't sign up. You don't know the plan ahead of time. You just sign up through Medicaid. So basically, that plan has no authority to text you or call you. So the only way they can communicate with you today is via fax or via mail. Those are the two options. So what they have to do, in a sense, is mail you the first time and say, hey, by the way, can we text you and phone you? But very few people will respond to that via mail, right?
Right.
You can't text them back. So that's a big problem. So that's what the law forces these organizations to do. The wrinkle, and the more recent wrinkle, is with the new requirements to prove that you still should be on Medicaid. It means you have to prove you have a job. You have to prove you're either searching for a job. You have to prove your qualifications. Well, the only way to do that is via fax and mail today. And you have to do that every month. But it's very easy to do via text or online or through a phone call. But it's overcoming how do I do that when I have this other law in place that says those plans cannot actually text or call people that they didn't get authority to call them or consent. So that's the big issue that we were discussing. And it is a challenge. And so the hope is that they can make a carve out for healthcare, right?
Yeah, well, it's really interesting. So we work a little bit in fax automation and not necessarily in that context, but I think there's some similarities here in that, like, as marketers, do we have, like, what's your hot take here? Do we have an obligation? Because I think part of that discussion that you had with Abner, it went on to say, like, there are some companies doing some interesting things and maybe not following all of the rules. And so, like, as marketers, do we have an obligation to maybe push forward with technology and break out of some of this?
Yeah, for sure. I mean, there's just no way that this can work with just faxes. A fax has its place, and although we kind of laugh at the technology, it's still viable, right? It's just not very viable for individuals, right? Not all of us have fax machines sitting at home or even know how to access one anymore. So yeah, I think as a marketer, you have to be aware that these things exist. And I think you have to work with leaders in your local community to figure out how we can overcome this. Maybe there's a way to get mass consent, right? Is there a way you could do like a phone drive? I don't know. Like you can look at these things, and also at the macro level, you can get involved with Abner and other people who are really trying to push the government to make these exceptions and changes. And the big surprise that came from that interview is that there is bipartisan agreement that, okay, maybe we should make this exception for healthcare because we all want care, we all need care, and we should be able to communicate with patients via text if that's the best way, right? So
Make it more difficult to do something that's already not easy.
exactly.
All right, so I would love to nerd out a little bit on marketing, maybe more generally. So, what are some ways that you think can marketing marketing can help address some of the existing barriers to care. So we just talked through one of them with Medicaid, but let's build on that a little bit. Any thoughts from your conversations and conference attendance?
Yeah, I think one of the biggest ways is again going back to the digital front door, right? It's just making it easy for somebody to book an appointment because the last thing you want to do is if someone who's never sought care before, comes to the website and tries to make a booking and it's complicated, basically they're just going to give up, right? And then they're going to get more sick and they're going to end up in your ED. So I think there's a little bit of a moral obligation to try and make it as easy as possible for people to book an appointment, right? So that could be, hey, if you haven't got it right now, just make it easy to get your phone number, right? And
Right.
have a dedicated line for booking appointments as opposed to general inquiry lines. If you have something online, then make sure that that button is prominent on most pages to book that appointment. Even better would be finding a doctor local to me, knowing where I am, matching me, like doing almost like the dating, things where you match my language, you match my preferences, and then you surface to me only the docs that have availability that match those criteria.
Right.
All these things can be things that marketers can work on to make that access a lot easier. And then it's just raising awareness as well, like to make people aware, hey, these are the kinds of things that we can provide to you. This is the kind of care that you can get from us. So just doing all those very simple things are things that you can do to really improve access to care.
Yeah. And I would imagine in today's environment, just economically and what health systems are dealing with, I mean, margins have always been thin, but they seem to be getting thinner. And so I imagine that all of those things that marketing owns and maybe access teams as well become all the more important. It's kind of fun as a marketer myself, it's kind of fun to see like the growing importance of like the chief marketing officer or marketing teams within healthcare systems. So, what are you hearing in terms of like those leaders and their priorities to help drive business outcomes maybe now more than ever?
Yeah, I think there's a growing recognition that marketing teams and chief marketing officers have a very big role to play in terms of revenue and financial stability for hospitals and for health systems. And yeah, it is because of this very reason. You want to make sure that people, when they seek care, they book, they actually make the appointment. And then actually, when they make the appointment, they actually show up. So surprisingly, marketers are now getting involved in that process, which traditionally has not been an area where marketers get involved in, right? Once the appointment's booked, we kind of used to wash our hands and that was it. But now there's all of this behavior science that's coming in to say, well, what do I need to do to actually make sure they show up? Sometimes that could mean knowing that they have transportation challenges. So maybe I have to give them a free Uber or a bus ticket or something to get them to me. Or maybe it's looking more smartly to say, hey, wait a minute, I just made an appointment or they just made an appointment and they need back to backs. So maybe I need to move some things around. So yeah, I think marketers are growing in importance because there's a recognition that we need to protect those patients and make sure they get the care they need, but also that we capture that revenue, right? To borrow a term from B2B. But
Right.
I will also say that chief marketing officers are growing in importance because marketers are now getting much more involved on the HR side of healthcare.
Oh, interesting.
So they're having to advertise and they're having to promote their organization to attract nurses and doctors and technicians and just because we're losing more people, there's a shortage. And so they have to now get involved in that side of promoting their organization. It's not just about the patient side anymore. It's about the HR and staff side as well.
No, that's really interesting. I hadn't thought about that. I want to go back to something that you touched on kind of in the beginning of the conversation in terms of there's increased competition, there's telehealth, there's all sorts of things. So, talking about the same persona that we were just discussing, like what are some ways, in your opinion, that the healthcare marketers on the provider side can stand out in a increasingly crowded market?
Yeah, great question. Okay, so what you don't do is put up more billboards. That is, although that might help, it's just a very expensive way.
Yeah, what's the ROI on that?
Exactly, exactly. I think that there are ways. So again, I go back to you actually have to do a lot more locally. I think you have to be more involved in your community. That means going out in the community, maybe doing workshops and doing those kinds of things. It's really kind of going back to the 1960s style of marketing, right? Where you do something at the local Y, you do something at the local grocery store to say, hey, if you're going to be buying groceries, here's some here's a nutritionist. They can walk with you, they can talk with you and kind of teach you what you need to buy on a budget to have a balanced diet. Like those kinds of things will build the trust and generate the goodwill that when people now need to seek care, they go, oh yeah, I remember they came to my community, they helped me out. So yeah, maybe I'll go to them. So I think you need to do more of those kinds of things to stand out. I also think you just have to be smarter and this is where you have to borrow from retailers, is you have to get to know your community better. Really understand what is it that they are seeking, why is it that they're seeking care from you? What are the common issues that they're running into? And then tailor your message to their needs. That is the best way to stand out. It's not by blasting bigger and louder messages or coming out with a better ad campaign. It's really being more micro-focused on your personas and your community.
Yeah, that's awesome. Colin, I really appreciate the conversation today. It's clear you're super passionate, super knowledgeable. I loved learning from you from all of your different exposure to healthcare marketers across the industry. So thank you for tuning in to Digital Health on Air today.
Thanks for having me.